Prevention and Control Programs, Huang Wei Ling Medical Acupuncture and Pain Management Clinic, Brazil. Thank you.
Hi, good morning, good afternoon, or good evening to everyone. My name is Huang Wei Ling. I'm a medical doctor from Brazil. I would like to thank the organizing committee to inviting me to this conference to share some of my experiences. It has been 28 years since my medical school graduation. I have 6 specialties, the first being infectious disease. Though for the last 23 years, I've been working with medical acupuncture and traditional Chinese medicine. I've been working in worldwide medical conferences, all emphasizing to treat the patient as a whole in the energy point of view, and not just the patient's symptoms. Now I will present the study entitled "Why Do Patients Still Catch Hospital Infections Despite the Practice of Infection Prevention and Control Program?" This study is based on Hippocrates' thoughts that said that it's important to consider other ancient medical traditions within medicine prior to the knowledge we have nowadays. So today I will explain hospital infection control in the point of view of ancient medical traditions such as traditional Chinese medicine. And first, according to different points of view of other medical traditions, such as traditional Chinese medicine, the signs and symptoms of infections can have different meanings in our normal medical practice. Any redness, bronchial or otherwise purulent secretion, fever, or urinary pain may indicate infection. And TCM understands the infectious process in a different way. What can you see in this picture? A lot of circles on top of each other, right? In the next slide, the same circles can be seen in a different point of view. Depending on the angle and thus the point of view, this figure is seen differently. This is to illustrate what can happen with the human body. Signs and symptoms of our patients may be seen differently depending on the point of view. According to traditional Chinese medicine, for example, all the symptoms of physical, emotional, or psychological illness are caused by the imbalance of what is referred to as the internal energy or qi in Chinese. The term energy in Chinese medicine or qi is characterized as the image of steam rising from a pot of rice cooking on the stove. The steam represents qi, and the body is of the pot and the rice and the steam is the qi. In the different cultures in which the qi concepts appear, it's also called the energy, the life force, prana, and bioenergy, as well as many other names. And the energy present in our body is similar to electricity, the energy from a battery, power from the gas cylinder, or gasoline energy, or whatever fuel the car uses when filling up at the gas station. And before diagnosing the disease by laboratory or radiological exam, the symptoms can be caused only by the energy imbalances. And many times the patients complain symptoms, but the exams are normal. In this slide, we are showing the various phases where disease progresses in a healthy body. And during phases 1 to 3, only a slowing of the organ functions occur because of energy imbalances, and the patient has unaccompanied symptoms, but the laboratory exams are normal. In the phase 4, they complain symptoms, and the laboratory exams has some alteration. In the phase 5, the laboratory exams are excessive. And Western medicine diagnosis is only done in the phase 4 and 5. And what we wanted to show you in this presentation is the need to treat the patient in the beginning of the disease process in the phase 1, 2, and 3, when the patient has symptoms but not have laboratory alterations. The word disease used in English language is the negative word "ease" from the Greek. The word is defined as state of balance, smoothness, or harmony. Disease, therefore, would mean in its lexical sense, lack of balance, imbalance, in the same way proposed by Hippocrates and by traditional Chinese medicine. In this Oriental tradition, when disease occurs, it is a sign that there is an imbalance of these energies. These imbalances are generally caused by emotional, diet, or external factors, or a combination of these factors. And these imbalances can manifest in many ways. I will give you some example. In case of discharge of pus, it's considered to be the retention of humidity and heat in TCM. And many reasons can lead to the patients to retain heat and humidity. And the deficiency of the spleen pancreas meridian in TCM is also very common. And this meridian is responsible for the absorption of nutrients. And its imbalance will imbalance other energy meridians too. And one cause of this deficiency is the diet. When the patient eats more raw food, dairy products, sweets, and cold drinks, especially water, and it's chronic worried, they can imbalance the spleen pancreas and leads to the less absorption of nutrients, and in this case, less production of blood and the retention of liquid inside the body. And the redness is associated with excessive heat inside the body. As I previously said, this excessive heat can be caused by wrong eating habits, by the entrance of the external pathogenic factors or emotional issues. And the inappropriate diet that can cause heat retention includes fried foods, eggs, coconut, melted cheese, dairy products, these melted cheese, alcoholic beverage, chocolates, honey. And traditional Chinese medicine is based on the ancient theory of yin and yang. Yin and yang are the archetypal representation of the complementary opposites. Opposites forces that cannot exist without the other. One example can be found in nature: day and night, dark and light, heaven and earth, and so on. And traditional Chinese medicine understands these two energies and present inside our body and in nature as a whole. And to be healthy, we aim for a state of equilibrium between yin and yang energies. And if there is some imbalance of these two energies, symptoms and disease appear. And in this slide, I'm showing how I diagnose the various energies imbalances in the patients. I usually do some questions in the first appointment. When the patient has constipation, if he doesn't go to the bathroom to daily bowel movement, is the mean of blood deficiency. If the patient has excessive sweating during the day, this could mean Qi deficiency. And if the patient has hot flashes, like a woman in menopause, this is a sign of yin deficiency. And if the patient has yang deficiency, the patient usually have cold hands and feet in the extremities. And the patient could have heat retention when he had dry mouth, bad breath, itching, and bleeding gums, or abdominal pain, and microhematuria, etc. Another area of major importance in traditional Chinese medicine is the use of acupuncture. Recognized as medical specialty in Brazil since 1995, the modality suffered and still suffers lots of prejudice in the medical society. However, in the same way, many procedures considered normal in the past are now rejected. Acupuncture has been presenting itself as an effective tool in the treatment of most varied pathologies. as well as the use of high diluted medications such as homeopathy. And in the same way, the acupuncture, it has been shown itself as an extremely successful tool, many times less aggressive than the high use of high concentrated medication. Homeopathy is considered a medical specialty in Brazil since 1980. I've drawn a tree-like figure to show you better the differences between different viewpoints of procedure within medicine, which also can explain the functioning of the human being through a holistic view, which can be influenced by the external pathogenic factor that are usually not considered by the Western medicine point of view. And in this tree, you can see that this tree has a trunk with several branches, and coming out of each branch, there are several leaves. And here I'm showing that Western medicine usually treat the symptoms and disease at the leaf level, but traditional Chinese medicine considers the leaf level, but treats all the symptoms and disease at the root level, when you cannot see by the naked eye, because these root level are under the ground, and the energy is not usually seen by the naked eye, but they exist. In this root, there are 5-element theory, the yin and yang theory, and it considered the external pathogenic factors such as humidity, heat, wind, dryness, and cold. In the film, here I'm showing you the 5-element theory and the yin and yang theory that are in the root level. You can see the fire, the 5 elements is composed by the fire, earth, metal, water, and wood. And in the human body, it's represented by the internal massive organs such as heart, spleen, lung, kidney, and the liver. And they are all interconnected by the energy point of view, by the generation cycle. One element generates the other, and they can influence the formation of each other. And differently from the Western medicine reasoning, where one organ is independent from the other. And in this theory, we are considering the yin and yang theory too. Here in the human body, each element of the 5-element theory, I show you, I will not repeat again. One it's responsible for one internal organ. And there is a generation cycle, and there is a control cycle where one element can control the functioning of the other. And all this function is ruled by the flow of the energy of these forces, yin and yang blood. And when there is an imbalance of these 4 energies, or a combination of one of all these 4 energies, there it could be a deformation of the internal heat that is the beginning of one of the manifestation of this internal heat formation is the formation of the infectious process. In this case, could be the signs and symptoms of infection in the hospital, infection in patients admitted in this hospital, could have energy imbalances due to many reasons that I will say in this presentation, and can formate the internal heat leading to the infection symptoms. Well, in this presentation, so here I'm come back to the question raised in the title of this presentation: why do patients still catch hospital infections despite the practice of infection prevention and control program? And the ancient traditions of Oriental medicine bases itself in the energy concepts as the most important factor to the human health. Western medicine, on the other hand, sees the patient in an anatomical and physiological way. If you can understand the signs and symptoms presented by the patient at the energy level and treat each of them properly, the results can be more complete and the real cure can be achieved. One of the possible causes of why patients still catch hospital infection despite prevention and control programs can be associated, in my opinion, to the model used by the medicine itself today. This model was designed by Galen, a Greek physician who lived 500 years after Hippocrates and wrote theories about functioning of the human body, which were implanted in almost all medical colleges of the West. Sorry, can you turn off your speaker? According to Hippocrates, disease originates from the imbalance of these four humors, which are blood, phlegm, yellow bile, and black bile. And these humors determine the temperaments, which are sanguine, phlegmatic, choleric, and melancholic. Every physical body has in itself the elements to recover, as nature itself is the only healer, and the physician simply limits himself to accompany and obeying nature. And from the point, the model presented by Galen, where each organ is isolated working independently, we cannot see the human being as a whole. And in TCM, all organs are energetically interconnected with the flow of self-generation and self-control cycles. And if an organ becomes ill, as in the case of a liver, for example, which is directly affected by the diversity of drugs, this generates other disorders through the increase of internal heat, which clinically mimics an infection, such as reddening the skin or surgical incision, purulent discharge, and catarrh. And if we are not aware of what exactly is happening and treat this condition as an infection, a vicious cycle develops, worsening the patients rather than improving. Then, from the point of view of traditional Chinese medicine, a site with purulent hyperemia, secretion, or catarrh does not necessarily mean that the patient has a bacterial infection. It means that the patient has an imbalance of the internal energies, and it is up to us, the physician, to rebalance the energy so that the patient returns to this way of life without having to use many drugs. And these drugs can worsen the vital energy, increasing the chance of internal heat formation and creating what clinically could be interpreted as infection symptoms, such as hyperemia, heating, and redness. And in this slide, I'm showing the Arndt-Schultz law, originally formulated in 1988, stating the effects of different drugs concentration on an individual. This rule states that for all substances, small doses stimulate, moderate doses inhibit, and overdoses kill. And in this law, we are showing that the effect of the use of high concentrated medications in the hospital environment can reduce even more the vital energy of the patient that could be even low in this admittance and could generate internal heat formation and clinically mimicking the infectious process. But in this case could be only the signs and symptoms of the energy imbalances. And I compare this to a car mechanic. If the patient is sick, his engine is out of tune, and the doctor job is to get the engine tuned so that the patient has his or her functions working in harmony without having to use so many drugs. And according to Hippocrates, everybody has in it himself the elements to recover. It's only nature that heals, and the doctor should limit himself to accompany the nature. And when I traveled to China for the first time in 2008, I went to an almost 1 month internship in a hospital in Beijing. And there I noticed interesting things. In the room of the hotel where I was staying, there was a gallon of water of 20 liters with two little taps, one blue and one red. Blue and red. And the blue one was for the warm water, the blue one. And the red one was for the boiling water to drink or make tea inside the room. What is the difference between drinking warm water instead of drinking water at the room temperature or cold water? The energy of water is cold normally, and if we drink this water constantly, we will weaken the energy of the spleen and pancreas, which are responsible for the absorption of nutrients, as well as maintaining the blood in the vessels. For example, when a woman is menstruating for a whole month, could mean that she has weakened energy in the spleen and pancreas energy. And if the patient with spleen pancreas deficiency is hospitalized because of the Western custom of consuming dairy products, cold water, and eating raw food, he will be part of the majority of our patients with and could have spleen pancreas deficiency. And this diet practice in the hospital will continue inducing the patient in spleen pancreas deficiency, which will cause a liquid retention in their bodies, forming phlegm. And phlegm can be formed in any part of the body. When the patient is recovering from the wound, it can appear as a secretion. And if the patient keeps intake cold, what happens? This means that cold energy, when ingested, it generates internal heat, increasing the risking of reddening the skin, yellowing the secretion, and etc. And as far as the external factors are concerned, what we should observe is the environment in which the patient is located, and not only the pathology he has. This idea comes from the importance Hippocrates gave to the environment and to the inherent factors. And the external factors that may imbalance the patient's energy are the heat, humidity, dryness, cold, and wind. And the patients who are hospitalized, most of them are those who are chronically ill, having been medicated for years, which makes us think that each one's energy may be imbalanced. Being able to have the most diverse combinations of types of energy imbalances. And this graph shows a variety of combinations of energy imbalances among 100 medical records selected from 300 patients in my clinic, and each combination of these combinations of the energy imbalances found in these medical records. And if the energy is low, it may be forming internal heat, causing the infectious process symptoms. But it could be that the patient apparently healthy who suffered an accident and goes to the hospital could have some degree of energy imbalances before the accident. This energy imbalance could be a result of his eating habits, the life that he leads, much stress, etc. And energy imbalances are common. Patients can have imbalances prior to their hospital admission. Each patient is unique, and two patients with different energy imbalances may respond differently to the same treatment. And the external factors can penetrate through the skin and internalize in these patients that will weak energy and cause a disease like a sore throat, sinusitis, pneumonia, diarrhea, etc. Therefore, a patient in a hospital environment should avoid wind, not only because the use of the ventilator may be the source of bacteria or fungus, but the wind itself can cause the energy imbalances and begin the induction of the formation of the internal heat formation inside the body, leading to the hyperemia and yellow secretion and simulating hospital infection. And if and the same orientation would be with regards to air conditioning. Cold, in my opinion, is the main pathogenic factor generating hospital infection. And penetrating the skin, the cold can be internalized in the body, causing lack of appetite, coryza, pneumonia, intestinal constipation, body aches, etc. And if used in a hospital environment, airflow should not be directly at the patient, but to the ceiling. For this, we should always be careful to cover patient with at least one sheet, even in the warm climate, so that the external pathogenic factor does not penetrate the skin and the sheet works to block this effect. In this slide, I would like to emphasize the need to cover the patient at least with one sheet to difficult the penetration of wind and cold in the upper part of the chest, because these are the regions where the wind and cold penetrate, and the beginning of the energy imbalances by this penetration. And this situation is very common in patients who take a shower with an open window and open door, and causing a flow of air and wind in the bathroom. And in this case, a weakened patient, it can be a factor to begin the energy imbalances and leading to the beginning of the infectious process, simulating an infectious process, and thus become a snowball, because with the introduction of drugs and often broad spectrum of antibiotics can cause a worsening of the energy condition of this patient, forming more internal heat in infection, as already explained before. And the invasion of cold inside the patient's body can generate fever and chills. And this symptom may be mistakenly interpreted as an established infectious process. An empirical treatment with antibiotics is often initiated, resulting in a drop in the vital energy of the patient, generating more internal heat formation. And in some professionals' procedure, they usually recommend compresses of cold water or ice to reduce fever, leading to the entry of cold energy in the patient's body, which was the factor causing the fever, causing a vicious cycle, further complicating more the patients. Every procedure that will generate increased use of medication will generate reduction of vital energy and consequently formation of more internal heat inside the body of the patient, and with the appearance of signs and symptoms of local infection. For example, it's very common to see black tea and coffee being served to the patient after their dinner in the hospitals. At least what I have noticed in Brazilian hospitals. And this procedure will cause an imbalance of the internal energy, often leading to insomnia in patients who are hospitalized and who end up using diazepam, Rivotril, and other medications to induce sleep. And when taking these medications, according to the Arnschult's law, a high concentration drug will cause a drop in the vital energy and the formation of more internal heat, and creating heat by aggression of the liver situation. And a diet with a so-called health program, which recommends raw food, can be the villain to the beginning of malabsorption of nutrients, leading to anemia or deficiency of blood and subsequently internal heat formation. And regarding the water, the use to wash the enteral catheter after the diet is recommended that is boiled here, because not only because of the risk of contamination in the water, but to change the energy of water that is cold to the neutral, in this way not causing energy imbalances when entering the human body and not generating in this way heat formation. And diet's usage should not contain cow's milk because in this composition, because it could harm the spleen pancreas energy and can begin the formation of phlegm in the body, leading to infection process. And this diet should not even never icy, because cold diet could induce more internal heat. And with regard to nebulization, in addition to normal hygiene care, we must take care that the liquid to be inhaled at is at the body's temperature. Because if you put a cold liquid here, you can cause a thermal shock and cause cough, asthma, attack, fever, and can confuse it with an infectious process. In this slide, we are showing the assignment symptoms of that can inform us the energy imbalances that I told you. And here are some, here is a process that I treat the patients with the infectious process using only this apex bloodletting to take out the internal heat. And in this case, treating the community acquired or hospital infection, I can treat using only taking out the heat retention here through the apex bloodletting. And here in this slide is only to show you the necessity of integrating the reasonings of the two medicine, traditional Chinese medicine, in Western medicine to understand better the formation of hospital infection in the patients. And in this presentation, we have attempted to explain a possible cause of implanting all infection control measures and the patient continuing to contract nosocomial infections. And in order to control a hospital infection, we must understand how the human body works in its deepest sense, meaning at the energy level. And these laws, including the theory of the 5 elements and yin-yang, and we need to look at each symptoms and understand what each one represents and energetically in the body to know how to treat it and also how to prevent the occurrence of such factors. And look at each symptoms and understanding what each one represents at the energy level in the body is a different approach from what most of us are doing now. And in this way, we would have the condition to know how to treat the various forms of hospital infection and also how to prevent their occurrence. And each patient is unique and each one has their own energy disturbances, and so they have to be evaluated individually to have a successful result in their treatment. Here's the publication of this article. It was published two years ago. And here's a Hippocrates quote: everyone has a doctor in him or her. We just have to help in its work. And the natural healing force within each one of us is the greatest force in getting well. Our food should be our medicine, and our medicine should be our food. But to eat when you are sick is to feed your sickness. Thank you for your attention. If you have any question, please, I will be happy to answer you. Thank you.
Ms. Elvesa, thank you, Dr. Huang, for this very interesting topic. I just wonder, how do you manage for those patients with malignant hyperthermia? Because usually we put, you know, those cold blanket. Do you think we can solve in another way?
Because in the hospital environment, you need to see not only the patient's symptoms, you need to study the environment that the patient is regarding the air conditioning, the temperature of the room, to avoid to turn on the air conditioning when the patient has fever, because the entrance of the cold and wind in the body, it could be the possible causes of this fever. And you cannot put ice to treat this patient. You need to cover all the skin to don't allow the entrance of this wind and cold, maintaining the fever, because the fever could be the entrance of this external pathogenic factor inside the body. And if you need to check the windows of the room, the patient cannot sleep with the open windows, because during the night, the temperature of the temperature will decrease in the after midnight. And if the room that the patient is in the hospital, the window is open, it will you will permit the entrance of wind and cold inside the body of the patient, and the patient will worsen his condition and could have fever, only because it is this external pathogenic factor is going inside his body. And this is why you need to turn off all the ventilators and air conditioning, and close the windows, and open the window that is not going, the wind and cold cannot go directly to the patient. And you need to cover his skin to don't allow this entrance in his body. And when the patient is in the hospital and maintaining the fever, you need to avoid the ingestion of raw food, because raw food has cold energy. And the food that has cold energy is similar that when you have cold inside, you are permitting to go cold energy inside the body through the foods. And that's why you need to only give a boil or grilled foods to this patient. And the water of this patient should be at a temperature of about 32 to 35 degrees of temperature, because you need to change the energy of the water from cold to neutral water. Because if you don't do this measurement, the water can induce fever, because this patient is very weak in energy. And when the cold water you ingest, the patient is ingesting this cold water, it will turn heat inside the body and will produce some energy imbalances and can induce the fever. And this is very common, this water ingestion here in hospital in Brazil. They only offer the water in very cold temperature, even in patient that is after having baby. It's very bad, this situation for the patient, or even patient treating pneumonia in UCI. They always give cold water to the patient and complicating this patient very much, only because you are giving wrong temperature of the water. And if you change this measurement, you can reduce very much the complications of this patient inside the hospital, and reducing the hospital infection and the need for the patient to give the antibiotics, because if you give antibiotics in this situation, the patient will weaken more the energy and will worse even more, and it will complicate the admittance of this patient in this case. And that is why if you use simple measurement, knowing these factors that could complicate the patient, you can reduce very much the hospital infection in your hospital.
Thank you for that. But I have another question.
Okay.
For a person that is not sick, okay, it's not a patient, okay, and in countries where there's sometimes a heat wave like 40 degrees, okay, So it's advisable for them, even though they feel warm because of the heat wave, to drink warm water instead of cold water?
Yes, I have one study that I will publish. I am showing in another study that I'm presenting about hospital infection. I did in my clinic that the majority of the patients that I attend in my clinic, I study about 1,000 patients, measuring the energy in the chakras, that I measure the energy of the internal organs of these patients. And more than 90% of my patients in my clinic that don't have any serious disease, they don't have energy inside the body. And this means that I think the majority of the patients that don't have disease, they can have energy impairment before any admittance in the hospital. And I think the patients that is hospitalized, they are more serious than this kind of patient that I attend in my clinic. And in my opinion, we need to treat these patients in the energy of point of view, treating their lack of energy before any surgical procedure in the hospital. Regarding your question about the heat in the room, I think you said
It's
that
not in the room. It's the temperature. For example, the temperature outside, the example, there's a certain country, I don't know, example like in Asia, okay? Sometimes there are some temperature that is above 32, like 40 degrees. So we call that heat wave, okay? So people are sweating, outside, but they are not sick, they are sweating.
All this is
So my question is,
pathogenic
so
factor.
it's advisable for them, even though they're perspiring, to eat warm water instead of, because usually when they feel warm,
It's
feel
very
like
important. Yeah, it's very important to drink warm water, because what will happen if we allow the ingest very cold water, because inside the body the temperature is about 35, 36 degrees, and if you ingest a cold water like a 5 degrees or 0 degrees, you will cause a drop in the vital energy when ingestion. And when the patient is transpiring, all the pores are open. And if you ingest the cold inside this body that is sweating, you will induce the cold to enter in the body. That cold is the main external pathogenic factor that could begin the induce of the formation of many disease. And in this case, the infectious process, you can begin to have a sinusitis, sore throat, and could have pneumonia and constipation and fever, and the formation of the disease in the energy point of view, only allowing the people ingesting cold water in these countries where the temperature is very hot. And this is why when I went to China 4 years ago, I went to the restaurant. The climate is more than 42 degrees in China. And I sit in a restaurant there with my friends, and how can I say, the woman in the restaurant, she bring water for all of us to drink at 35 degrees. The water was warm water. They never drink cold water in any situation. Even in the hot temperature, the Chinese population, they drink warm water. They usually don't drink any ice water or cold water, because inside our body, the temperature is not cold, it is warm. And if you drink cold water, you will begin to begin the energy imbalances, and begin all the imbalances leading to infectious process or other disease, such as if you give cold water in diabetic patient, you can see if you give cold water in diabetic patient, the glycemia of this patient will rise very much. And if you give warm water to your diabetic patient, the glycemia of the patient will reduce. You can do these experiments and then you can tell me what happens. Okay?
Thank you. Thank you for the.
One second, I can say